So welcome back. Let's take a look at some other news now. Teenage alcohol abuse is an increasing concern in South Africa, with a surge in underage drinking contributing to school dropouts, violence and risky behaviour. So why is alcohol still so accessible to minors, and what role can families and communities play in curbing this worrying trend? So let's talk about this now with Tebogo Ramadiro, who is a substance use coordinator at the South African Depression and Anxiety Group. Tebogo, thank you so much for talking to us this morning. This is a very important topic, and I want us to start here. How big is the problem?
Thank you so much, Griselda. So the substance abuse among teenagers is like you said, it's a pressing health concern, which is driven by various factors: exposure to alcohol advertising, parental influence, and the impact and also impact on alcohol abuse in teenagers and physical and mental development. So it's a huge concern.
Yeah, and let's talk about accessibility to alcohol. I know the restrictions are there, but underage children are still able to access alcohol, which is not supposed to be the case.
True. There is an interesting point that you're making. It's still a concern within our communities that minors as well are able to get alcohol even though they're under the age limit. So with that, we're saying that we need to find different alternatives to make sure that children don't get access. But as you are aware, that the advertising that is available out there, content that children get access to, giving them that exposure. And also we need to have preventative measures where alcohol is being sold, where they ask for the person's ID identification so that they tell whether the person is minor or not.
Yeah, we often talk about, the physical dangers of alcohol, but, there are psychological dangers as well, and or emotional factors that are drawing young people, to drinking in the first place. What link do we see, Tebogo, if at all, between mental health challenges, socioeconomic conditions, and the rising alcohol abuse amongst teenagers?
Okay, let me answer you by saying this, that there is a link between psychological factors. And so if you can look at alcohol abuse, there's short-term effects to it and also long-term effects to it. So the short-term effects, we're talking about violence, risky behavior, being involved in engaging in unprotected sex. So these are the short term. So if I can draw you back to the previous incident that we had in May I think if my recollection is correct, the UJ students had an altercation with a matric student. And then in that incident, there was alcohol involved. So these are the short-term effects that we're talking about when we talk about alcohol consumption that can lead to accidents. The long-term effects, it's teenagers who start drinking at an early age, which can affect their learning capabilities. As we know that for a brain to be fully developed, it has to be developed at the age of 25. So imagine a 13-year-old who has started drinking, the effects, the learning developments, the learning challenges that they're going to have due to the use and abuse of alcohol. So these are the effects that we see. Psychologically as well, it can lead to depression because alcohol is a depressant.
And you work closely with the youth, and you understand the long-term impact. But what are some of the developmental, academic, or behavioral consequences you've observed, when teens begin drinking at an early age?
So that is a good question that you're asking. And so in my line of work, because that is not my area of expertise, I think we also will need to have like a psychiatrist on the panel. Yes. But what we've noticed when we receive the calls from the loved ones that are reaching out to the helpline is that the children are not even able to comprehend in terms of concentrate in class, which speaks to the learning development that you're talking about right now, that you're asking about right now. Some of them, they have got behavioral issues in class. Some of them are fighting with their teachers. I think in when we watch the news, we see a lot of, or when we watch the videos that are out there, we see a lot of learners having behavioral issues, which is speaking to the use and abuse of alcohol.
Yeah, and I mean, many families, some may feel helpless as well, or unsure of even how to intervene. I mean, what practical steps can parents, caregivers, schools, and even faith-based groups take to prevent or respond to alcohol abuse amongst young people, in communities? We often see, sometimes parents or grannies, grandpas who are staying with teenagers, unable to deal, with the violence that comes with some of the behaviors of young people involved in this kind of abuse of alcohol.
So, as this tomorrow will be Youth Month, Youth Day, excuse me. So the things that families can do, or what parents can do, is having these campaigns in the schools, which is quite critical, which is to educate around the dangers of using alcohol. Again, also in our family setups, we need to be mindful of the celebrations that we're having, to say that, are we not triggering, or are we not introducing alcohol in our families, making it to look like it's fashionable. So grandparents who are struggling with young children or teenagers who are using alcohol, is to connect them with various helplines, like the SADC helpline that is available, various NPOs that are available, to teach these young children to say what is proper use. Because remember, with the using of alcohol, there's age limits in place, right, that are imposed. But at the same time, our adults who are using alcohol, we need to also assess how is their relationship with alcohol. So if parents are seeing challenges or mood behaviors changing in their children, they can call through to the helpline, where we can also, our counselors are trained, we can also educate and provide information to say where can they connect to get help. So we are just saying that we should use the platforms that are available within our country, which, sometimes we think that it's not a lot, but on the helpline, we are a touch point that is available nationwide, so that we can guide and provide guidance to the parents who are feeling helpless with the use and abuse of alcohol.
Yeah, and I mean, finally, from a policy and support standpoint, are government efforts and the current prevention campaigns making a difference? Are they really making a difference? And what urgent interventions, would you recommend to curb this growing trend of underage drinking in South Africa?
So what I can say is that efforts are being made. As you know, that substance abuse, nevertheless, only alcohol, it's a huge challenge in our country. So this requires, in terms of policymakers, this requires collaboration, in terms of the development of policies that are being made. So it's more of a collaboration that needs to take effect. But within, if I can make a reference on the helpline, we are receiving a lot of calls where we are able to reach to parents and loved ones. We've had situations where a parent called in, they were struggling with their child that was using alcohol. With the various interventions that we put in place and help them, the child was able to get help because the child was 18, so was able to get into a rehab facility. So policies are available. There is strides that the government is making, but it requires a lot of collaboration, and it's going to take us a while, but we will eventually get where we need to. It's just on our baby steps, working on this challenge.
Yeah, absolutely. A very important conversation to be had, Tebogo, especially as we mark, June 16 tomorrow, Youth Day, a very important conversation to talk about some of, the strides that young people are making and some of the challenges that they're still experiencing. Thank you very much indeed, Tebogo Ramadiro from the South African Depression and Anxiety Group, shedding light on the growing crisis of, teenage alcohol abuse and the urgent need for a stronger community policy and even family response.